Welcome to the Patient Safety Institute. The program you are enrolled in includes high-fidelity patient simulation, a form of experiential learning. This type of learning works best if you completely engage, if you commit to the experience. To help you do this, we've produced this short video demonstrating what simulation looks like. Please watch carefully and use this as a model for your own activity here at PSI. Good luck.
Hey, Mr. Smith, I'm Andrew. I'm one of the nurses. I'll be taking care of you. How are you feeling today?
Hi, Andrew. I can't breathe.
You can't breathe? When did all that start?
Probably about an hour ago.
Alright, I'll be right back. I'm going to wash my hands and grab a pair of gloves, and then we're going to help you breathe better, okay?
Okay.
Alright. Cautions. Can you tell me your name and date of birth, please?
Sure. My name is John Smith. I was born May 1st, 1980.
1980. And can you just spell that for me, John Smith?
Sure. That's John. And Smith is MSMITH.
Alright, and when did all of this start?
Probably about an hour ago.
An hour ago. And what were you doing when it started?
I was actually outside walking around.
Yeah? And has anything like this ever happened to you before?
You know, it kind of feels like my asthma.
Your asthma?
Starting back up, yeah.
Okay. And do you have asthma attacks frequently?
Not frequently.
Okay.
But I do get them every once in a while.
How often would you say you used your inhaler this week?
This week?
Yeah.
I don't know, maybe once or twice.
Okay. And did you take your inhaler today when you started having some trouble breathing?
I did not. I left it at home, actually.
Okay. And what medication do you take in the inhaler?
I think it's like albuterol.
Albuterol?
Like that.
Sure.
Yeah.
And do you take any other medications for anything?
I just take some vitamins daily.
Okay. And do you have any allergies for food or medicine?
It's a penicillin.
Penicillin? Okay. We're going to have to get you an allergy bracelet for that. All
Okay.
right. And any other medical problems? Any heart problems?
No, just the asthma.
Okay. And any surgeries in the past?
I had my tonsils removed when I was younger.
Your tonsils out? All right. I'm just going to take a quick listen, all right? You're certainly wheezing. How would you say that this asthma attack compares to ones that you've had previously?
Previously, this one's a little bit worse.
Okay.
Usually I have my inhaler with me, and I just use it and I feel better.
Okay. And have you ever needed a breathing tube for your asthma? Have you ever had to be intubated and go into ICU?
No, it's never been that bad.
Okay. Have you ever had to be admitted to the hospital for your asthma?
When I was younger.
When you were younger? Okay. Just give you some oxygen, okay? Help you breathe a little bit. Any recent travel anywhere?
I just came back from Florida about a week ago.
A week ago?
Yeah.
Alright. Alright. Your skin is warm and dry, that's good. Have you had any fevers recently?
No.
No. Okay. Any headaches?
No.
Nausea, vomiting?
No.
Any chest pain?
No.
No? Okay. I'm going to do a quick EKG, take a look at your heart, make sure everything looks okay with that. Alright? And then I'm going to call the doctor and chat with him and see if we can get you feeling better. Alright.
Okay.
Alright, so I just want to review. John, you're 35 years old. About an hour ago, you started having shortness of breath, felt like an asthma attack come on. You were just outside kind of walking around, not exerting yourself too hard. Is that correct?
Yeah, that's correct.
And you didn't take your inhaler because you forgot it at home or you couldn't find it in time, so you just came to the hospital?
Yeah, that's right.
All right, and you take albuterol.
Uh-huh.
And you're allergic to penicillin?
That's right.
All right, I'm going to give the doctor a call, all right?
Okay.
Hey, Dr. Jones, it's Andrew in the ER, bed 2. I have Mr. John Smith. He's a 35-year-old gentleman coming in with an acute exacerbation of his asthma. He's currently hypoxic with the pulse ox somewhere around 88. He's having some difficulty breathing and using bilaterally. I recommend that you come and see him and that we start him on albuterol Atrovent treatment, along with giving him 125 milligrams of salmeterol IV. Alright, so you want me to start with an albuterol Atrovent treatment by a nebulizer and establish an IV and give him the 125 of salmeterol? Excellent, and will you be coming to see him? Alright, in the next 5 minutes. Excellent, thank you so much, Dr. Jones. Alright, so Dr. Jones is going to come take a look. We're going to give you some medicine through a mask called albuterol, like you take it through your inhaler, plus another medicine called Atrovent. It's going to help you breathe a little better. Plus I'm going to give you some medicine through the IV, okay?
Alright.
Alright. Alright. You're going to get this in your mouth. I want you to take some nice deep breaths, alright?
Okay.
Any belly pain when I push over here?
No.
Alright, how about over here?
No.
Here?
No.
Okay. And take a quick look at your feet, alright? Have you noticed any ankle swelling?
Mm-hmm.
Alright. Take another listen. All right. Now, Mr. Smith, I'm going to give you some medicine through the IV. It's called salmeterol. It's a steroid. It's going to help reduce some of the inflammation in the lungs. All right?
Okay.
And I know you said you were allergic to penicillin. Just want to confirm you're not allergic to anything else.
No.
All right. All right. That treatment's just about done. How you feeling?
I feel much better.
Much better.
Yeah.
Let me take another listen. Yeah, your wheezing has gone away. That's excellent. Let me know if you need anything, okay? The call bell is just next to your left hand, and that also controls the TV remote for your comfort if you want to watch anything, all right?
Alright, thank you.
All right. You just give a shout if you need anything. I'll be back in a couple minutes.
Okay.